Hello everyone. This week we're going to talk about cognition. Please remember this is your study guide. You want to look at the class learning outcomes to prepare for your exams. You will use it to guide your reading, note-taking, and your studying. All right, let's dig in. So cognition is a broad term for all the processes involved in human thought. It includes reception of sensory inputs, its processing, storage, retrieval, and use. As nurses, we need to understand that cognition isn't an all or nothing state. It exists on a spectrum from optimal functioning to severe impairment. The key attributes we'll focus on are consciousness, memory, executive function, and confusion. A great example of cognitive function is planning a simple task like making a grilled cheese sandwich. This requires a series of steps and forethought. This falls under executive function. The brain is the command center for cognition. Its function relies on a continuous supply of oxygenated, nutrient-rich blood. This means that any issue disrupting the supply, like a drop in blood sugar for diabetes or an electrolyte imbalance, can directly affect a person's ability to think clearly. A crucial point to remember is that while some cognitive decline can happen with age, true impairment, like dementia, is not a normal part of the aging process. When you think about cognition on the continuum, at one end you might have a person who may need a moment to recall a name, but if they are unable to remember what they did yesterday, that's a more significant concern, and it would be further down the spectrum. Risk factors for impaired cognition span the entire lifespan. While we often think of the elderly as being most at risk, infants and children are also vulnerable to issues like genetic disorders or hypoxia at birth. Behaviors like substance abuse and risk-taking can cause brain injuries and are significant factors for any age. For example, not wearing a helmet while cycling puts you at risk for a traumatic brain injury, which can lead to long-lasting cognitive impairments. Many chronic health conditions can also increase risk. For instance, uncontrolled diabetes can damage blood vessels over time, which reduces blood flow to the brain, which leads to cognitive issues. Now let's differentiate between two key types of cognitive impairments, delirium and dementia. Delirium is an acute and potentially reversible state of confusion. The onset is sudden, over a matter of hours or a few days. Patients with delirium often have a fluctuating level of consciousness. They might be disoriented one moment and lucid the next, and they can be easily distracted and inattentive. The key to managing delirium is recognizing that it's a symptom of an underlying medical condition. Common causes might be infection, pain, hypoxia, dehydration, or a medication side effect. For example, a patient with a urinary tract infection might suddenly become confused, agitated, and start hallucinating. Once we treat the infection, their confusion should resolve. In contrast, dementia is a chronic condition with a slow onset over months to years. It is progressive, irreversible decline in mental abilities, often with a clear consciousness and normal speech, at least initially. Dementia is caused by physical changes in the brain from diseases like Alzheimer's or vascular dementia. A simple example is a person who has difficulty finding the right words or has significant recent memory loss, like not being able to recall a conversation they had yesterday. When we look at nursing care and management for the patient with cognitive deficit, we want to focus on four main areas. First and foremost is safety. This includes fall prevention, using bed monitors for wandering, ensuring a safe environment. Second, communication needs to be simplified. We want to use short sentences, one idea at a time. For instance, instead of saying, "We're going to go have a bath and get you all nice and clean for your visitors," say, "It's bath time." Third, we must assess and orient the patient. We will want to use tools like the Confusion Assessment Method, or CAM, for delirium, and the mini-cog for dementia, which we'll go over in class and in clinical. We want to provide visual cues like calendars, clocks, photos to help them stay oriented. Finally, supporting the caregiver is critical. Caregivers of patients with dementia are at really high risk for depression and other chronic illnesses. We need to offer them supportive counseling, education about the disease, and respite options. Remember to use those objectives to collect your thoughts so that you can study cognition. See you in class.